I'm Ed Long, founder and CEO of Independence Anesthesia Services, and today is Monday, March 30th, 2020. As we begin the month of April, we wanted to get some information out to all of our providers regarding the novel coronavirus crisis we are all experiencing. Since we began our agency 16 and a half years ago, we've always prided ourselves on transparency and integrity with our providers and clients alike. This message is targeted more for our providers, and our team at Independence felt this would be the best mode of delivery for what we are experiencing in this chaotic time. Over the last 2 weeks, what we've witnessed, as client facilities and groups scramble to determine action plans through committees, our locums have been assisting ORs in select sites, providing relief for training for staff folks. So the good news is that there are still CRNAs performing CRNA functions essential to the patient. Our CRNAs that are still on the job are receiving PPE training and orientation of how new protocols have been established to handle the uptick and increased COVID-19 patients coming in. Communication between staff and our providers has been a little delayed in some cases, but we are confident they are simply overwhelmed and they're doing their best to keep everyone properly equipped and safe. We also saw a substantial number of locum assignments come to an abrupt halt, with providers being called off with little to zero notice. In literally every case where this happened, the phone calls to me ended the very same. Ed, we're sorry to have to do this, but, and every but was, we want them to come back as soon as this mess clears. I was okay, that's encouraging, but when? When is the question that's weighing on everyone's mind. When will life return to normal? No one knows for sure, and that is a truthful fact. Speculation is something I prefer not to engage in regarding that answer. I can share with you that over the last 2 weeks, we've been asked by several of our very large volume clients to anticipate what the market pricing structure will look like, or the estimate of availability of providers this summer. I can assure you all they are extremely anxious to get you back in the saddle. Let's face it, the last several years for locum anesthetists have been fantastic. It's been fantastic for you and our clients. They desperately want to crank those elective cases back up to full capacity. In the last 2 weeks, we've also seen cancellations where clients honored a 30-day cancellation, and in one case, a 2-week term-ending payout. These conversations also ended with, "We want them back." The clients that showed financial gratitude to our providers will be the ones who gain the most loyalty for returning providers in the future. We press for every single one of our people to get some financial compensation for immediate and sudden cancellation. We consulted with our legal and our organizations, and the bottom line is there's no precedent for the state of emergency that is currently in place that gives hospitals and healthcare provider groups wide latitude in reducing numbers on site in order to protect the provider and their local communities. This is a sad but unavoidable truth. There are currently some ICU intubation repurposing opportunities for CRNAs, and there are many that are developing daily. Here's what we know about that. We've been contacted by many clients, primarily polling whether or not we would have providers interested in these opportunities. And would our malpractice cover them if we shift the role? The answer is yes. Our policy, our carrier, has encouraged us to seek out these opportunities, and they will provide the appropriate certificate of insurance. We also know that the AANA sent out a message regarding this, and they too were agreeable. They would support those on their policy based on site location with minimal, if any, premium adjustments. So it's always good to be in alignment with what the AANA recommends. We currently have one of our large sites in Ohio orienting our first locum provider to an intubation team. I will say this, that the rates of negotiation are very difficult, and they are not what you are accustomed to seeing while working with us at Independence. As these opportunities develop through the week, we will keep you updated. A few things we saw over the last 2 weeks that were a bit disturbing. Blast emails going out from our competitors promising available assignments, which we knew clearly to be on hold. As of 2 weeks ago, we suspended any blast email campaigns to share new opportunities in the field. So as far as active placement-ready assignments, the truth is that they are literally all on hold. They may not be getting removed from certain internal job boards that we're members of, but the pause button has been pushed. So be wary of any hot job blast emails you receive this week from agencies you've never heard of, and mostly likely over the month of April. Please protect yourself from randomly submitting your CV for anything. If you are approached for a position or you see a listing that gets your attention, call us about it. Talk to us. We will give you straightforward answers. If you are a locum provider who is currently not registered with us, then you are not obligated in any way to join us or any other agency, just to talk about opportunities on the horizon. Our phones are live. We are working a skeleton crew here in the office while practicing social distancing, and many of us are remote with phone lines forwarded to their devices. So call us. We're here to talk, and we're here to let you know exactly what we're seeing with no rose-colored glasses. We do have clients that we work with that are signing commitment letters for late summer and fall of 2020 in anticipation of being back up and running. These clients have moved out of panic mode and are into planning and recovery mode. We do hope to see more of this developing this week and in upcoming weeks. We've received many calls asking about the stimulus package from you and asking if there are benefits that may apply to our independent contractors. Our tax and legal counsel are uncovering the details that unfortunately are not very encouraging. The package is an 880-page document and difficult for a layperson to interpret accurately, so we are relying on our advisors and experts for our information. Another common question we have received from you is, do I qualify for unemployment benefits? Unemployment benefits are determined on the state level, and each state has updated and published their respecting Secretary of State website. So I would encourage you to take a look at what is happening in your state. A few things to keep in mind while you're doing that. If you are a provider who does not have their own LLC or is a single member LLC, it will most likely not be possible for you to get an unemployment claim approved. If you are a provider, however, that has an LLC in which the LLC pays you a standard salary and payroll deductions are made into your state's unemployment fund, you may have a really good chance of getting approved. So if that is your scenario, I would encourage you to look into it sooner than later. If you are a provider who has a part-time W-2 gig and any hours that you were working and they have been eliminated, you will also have a very good chance to file a claim and receive some sort of compensation. I would lean in on your CPA for advice here or your personal attorney and file the claim. You don't know if you don't ask. Always been one of my philosophies. So ask for it. If you think you have a remote chance of getting it, go forward. It's truly a sobering time to work in anesthesia in any capacity. We are concerned but hopeful. We have been knocked back on our heels along with all of you. But like you, we're ready to stand up and fight forward. There is new information coming week to week. We will strive to share it with you as we get it. The whole nation has gratitude for what you all do. Please keep safe and take care.